Autoimmune diseases. Autoimmune diseases are a group of disorders characterized by an abnormal immune response in which the body's immune system mistakenly attacks its own healthy cells and tissues. Instead of defending the body against foreign substances like bacteria and viruses, the immune system targets its own cells as if they were invaders. There are many different types of autoimmune diseases, and they can affect various organs and systems in the body. Some common examples of autoimmune diseases include rheumatoid arthritis. This condition primarily affects the joints, causing pain, inflammation, and stiffness. Systemic lupus erythematosus, SLE. SLE can affect multiple organs and tissues, including the skin, joints, kidneys, heart, and lungs. Symptoms vary widely but may include joint pain, skin rashes, fatigue, and organ damage. Multiple sclerosis, MS. MS affects the central nervous system, leading to communication problems between the brain and the rest of the body. Symptoms can range from mild to severe and may include fatigue, muscle weakness, numbness, and difficulty with coordination and balance. Type 1 diabetes. In this condition, the immune system attacks and destroys the insulin-producing cells in the pancreas, resulting in high blood sugar levels and the need for lifelong insulin treatment. Hashimoto's thyroiditis. This autoimmune disorder affects the thyroid gland, leading to an underactive thyroid, hypothyroidism, and symptoms such as fatigue, weight gain, and cold intolerance. Celiac disease. It is an autoimmune disorder triggered by the consumption of gluten, a protein found in wheat, barley, and rye. When individuals with celiac disease eat gluten, it leads to damage to the small intestine, resulting in gastrointestinal symptoms, malabsorption of nutrients, and other health issues. These are just a few examples, and there are many other autoimmune diseases, including psoriasis, Crohn's disease, ulcerative colitis, Sjogren's syndrome, and others. The exact causes of autoimmune diseases are still not fully understood, but it's believed to involve a combination of genetic, environmental, and hormonal factors. Treatments for autoimmune diseases aim to control the symptoms, reduce inflammation, and suppress the abnormal immune response. This can include medications, lifestyle modifications, physical therapy, and sometimes surgery, depending on the specific condition and its severity. It's important for individuals with autoimmune diseases to work closely with healthcare professionals to manage their condition effectively. Psoriasis. This chronic skin condition causes the rapid buildup of skin cells, resulting in thick, red, and scaly patches. It can also affect the joints, leading to a condition known as psoriatic arthritis. Sjogren's syndrome. This autoimmune disorder primarily affects the salivary and tear glands, resulting in symptoms such as dry eyes and mouth. It can also cause fatigue, joint pain, and organ involvement. Ankylosing spondylitis. This condition primarily affects the spine and sacroiliac joints, causing inflammation and stiffness. Over time, it can lead to the fusion of the vertebrae, limiting mobility. Vasculitis. Vasculitis refers to inflammation of the blood vessels. It can affect various organs and systems, leading to symptoms such as rash, fever, fatigue, muscle and joint pain, and organ damage. Myasthenia gravis. This autoimmune disorder affects the neuromuscular junction, resulting in muscle weakness and fatigue. It can affect the muscles involved in voluntary movements, including those controlling eye movement, facial expression, and swallowing. Pernicious anemia. It is an autoimmune condition in which the immune system attacks the cells in the stomach that produce intrinsic factor, a protein necessary for the absorption of vitamin B12. This leads to a deficiency of vitamin B12, causing anemia and neurological symptoms. Alopecia areata. This condition causes patchy hair loss on the scalp and sometimes other areas of the body. It occurs when the immune system attacks the hair follicles. Addison's disease. This autoimmune disorder affects the adrenal glands, resulting in insufficient production of hormones such as cortisol and aldosterone. Symptoms may include fatigue, weight loss, low blood pressure, and changes in skin color. It's important to note that autoimmune diseases can sometimes overlap or coexist, and individuals can be affected by more than one autoimmune condition simultaneously. The specific symptoms, severity, and treatment options can vary widely for each autoimmune disease, so it's crucial for individuals to consult with healthcare professionals for accurate diagnosis and personalized management. Pemphigus. Pemphigus is a group of rare autoimmune blistering disorders that affect the skin and mucous membranes. It causes the immune system to attack the proteins that hold skin cells together, leading to painful blisters and sores. Polymyalgia rheumatica. This condition primarily affects older adults and causes muscle pain and stiffness, usually in the shoulders, neck, and hips. It is often associated with another autoimmune disorder called giant cell arteritis, which involves inflammation of the blood vessels. Goodpasture's syndrome. This rare autoimmune condition affects the lungs and kidneys. It involves the production of antibodies that attack the lungs' alveoli and the kidneys' glomeruli, leading to respiratory and kidney problems. Antiphospholipid syndrome, APS. APS is an autoimmune disorder that causes an increased risk of blood clots. It can lead to a variety of complications, including deep vein thrombosis, stroke, recurrent miscarriages, and other pregnancy-related complications. Primary biliary cholangitis, PBC. PBC is a chronic autoimmune liver disease characterized by the destruction of the small bile ducts in the liver. Over time, it can lead to liver scarring, cirrhosis, and impaired liver function. Dermatomyositis. Dermatomyositis is an inflammatory muscle disease that primarily affects the muscles and skin. It leads to muscle weakness, skin rash, and sometimes systemic symptoms such as fatigue, weight loss, and joint pain. Wegener's granulomatosis. Granulomatosis with polyangiitis. This rare autoimmune condition primarily affects the blood vessels, causing inflammation and tissue damage in various organs, particularly the lungs, kidneys, and upper respiratory tract. Myasthenia gravis. Myasthenia gravis is a chronic autoimmune neuromuscular disorder that causes muscle weakness and fatigue. It occurs when the immune system mistakenly attacks the receptors on muscle cells that receive signals from nerve cells. Remember, autoimmune diseases are a diverse group, and there are many more specific conditions beyond those mentioned here. If you have concerns about a particular autoimmune disease or suspect you may be experiencing symptoms, it's essential to consult with a healthcare professional for an accurate diagnosis and appropriate management. Mixed connective tissue disease, MCTD. MCTD is an autoimmune disorder that shares features of multiple other connective tissue diseases, including systemic lupus erythematosus, scleroderma, and polymyositis. It often presents with a combination of symptoms such as joint pain, muscle weakness, skin abnormalities, and organ involvement. Autoimmune hepatitis. This condition involves inflammation and damage to the liver caused by an autoimmune response. It can lead to progressive liver damage and, in some cases, cirrhosis. Eosinophilic esophagitis, EOE. EOE is an autoimmune condition characterized by inflammation in the esophagus. It can cause difficulty swallowing, chest pain, and food impaction due to the buildup of eosinophils, a type of white blood cell, in the esophageal lining. Autoimmune encephalitis. This is a group of autoimmune disorders that involve inflammation of the brain. It can result in various neurological symptoms such as seizures, memory problems, cognitive impairment, and behavioral changes. Scleroderma. Scleroderma, also known as systemic sclerosis, is an autoimmune disease that affects the connective tissues, causing hardening and tightening of the skin. It can also affect the blood vessels, internal organs, and joints. IgA nephropathy. IgA nephropathy, also called Buerger's disease, is an autoimmune kidney disease characterized by the buildup of the protein immunoglobulin A, IgA, in the kidneys. It can lead to kidney inflammation and damage over time. Autoimmune uveitis. Uveitis refers to inflammation of the middle layer of the eye, called the uvea. Autoimmune uveitis occurs when the immune system mistakenly attacks the eye tissues, leading to eye pain, redness, blurred vision, and light sensitivity. Bullous pemphigoid. Bullous pemphigoid is a chronic autoimmune skin disorder characterized by large, itchy blisters that develop on the skin. It occurs when the immune system targets the proteins that connect the top layer of skin to the underlying layers. Remember, there are many autoimmune diseases, and this list is not exhaustive. If you have specific concerns about a particular autoimmune disease or suspect you may have one, it's important to consult with a healthcare professional for proper evaluation, diagnosis, and management. Can extreme stress cause autoimmune disease? While stress can have various effects on the body, including on the immune system, the direct relationship between extreme stress and the development of autoimmune diseases is still not fully understood. Autoimmune diseases occur when the immune system mistakenly attacks healthy cells in the body, leading to inflammation and tissue damage. Research suggests that chronic stress may contribute to the development or exacerbation of autoimmune diseases, but it is usually not the sole cause. There are typically multiple factors involved in the development of autoimmune diseases, including genetic predisposition, environmental triggers, and dysregulation of the immune system. Stress can affect the immune system in several ways. It can disrupt the balance of immune cells and inflammatory responses, making the body more susceptible to inflammation and immune dysregulation. Stress hormones, such as cortisol, can also impact immune function by suppressing certain aspects of the immune response. However, it's important to note that stress alone is unlikely to directly cause autoimmune diseases. It may act as a contributing factor or trigger for individuals who are already predisposed to developing these conditions. Additionally, the relationship between stress and autoimmune diseases can vary depending on the specific disease and the individual's susceptibility. If you're experiencing extreme stress or have concerns about your health, it's always advisable to consult with a healthcare professional who can provide personalized advice and guidance. Lifestyle to avoid autoimmune disease. While there is no guaranteed way to prevent autoimmune diseases, adopting a healthy lifestyle can potentially help reduce the risk or manage the symptoms of these conditions. Here are some general lifestyle suggestions that may be beneficial. Eat a balanced diet. Consume a variety of nutrient-rich foods, including fruits, vegetables, whole grains, lean proteins, and healthy fats. Consider an anti-inflammatory diet that includes foods such as fatty fish, olive oil, nuts, seeds, and colorful fruits and vegetables. Exercise regularly. Engage in regular physical activity, such as walking, jogging, swimming, or cycling, to support overall health and boost your immune system. Consult with a healthcare professional before starting any new exercise program. Manage stress. Chronic stress can negatively impact the immune system and increase inflammation. Practice stress management techniques like deep breathing exercises, meditation, yoga, or engaging in hobbies and activities you enjoy. Get adequate sleep. Aim for 7 to 9 hours of quality sleep each night. A well-rested body and mind contribute to a stronger immune system and overall well-being. Maintain a healthy weight. Obesity and being overweight may increase the risk of developing certain autoimmune diseases. Focus on maintaining a healthy weight through a balanced diet and regular exercise. Avoid smoking. Smoking can worsen symptoms and increase the risk of autoimmune diseases. If you smoke, seek support to quit. If you don't smoke, avoid exposure to secondhand smoke. Limit alcohol consumption. Excessive alcohol consumption can impair the immune system and promote inflammation. If you drink alcohol, do so in moderation as per recommended guidelines. Protect yourself from infections. Practice good hygiene, including frequent hand washing, getting recommended vaccinations, and avoiding contact with sick individuals to reduce the risk of infections that may trigger or worsen autoimmune conditions. Minimize environmental toxins. Reduce exposure to toxins such as chemicals, pollutants, and pesticides as much as possible. Use natural cleaning products, avoid unnecessary chemical exposure, and ensure good ventilation in your living spaces. Regular medical checkups. Stay proactive with routine health checkups and screenings. Early detection and prompt treatment of any potential health issues can help manage autoimmune diseases effectively. Remember, while these lifestyle factors may be beneficial, they do not guarantee prevention or cure of autoimmune diseases. If you have concerns or symptoms related to autoimmune conditions, consult with a healthcare professional for a proper diagnosis and appropriate medical advice.